Hello, I'm Marwan Abourass. I'm going to speak about the history and necessity of the 4R operational diagnosis protocol. Back in 1970, I was the chairman of the Endodontic department at USC. At that time, there were 15 part-time endodontists from the Los Angeles area and nearby city teaching undergraduate endodontic curriculum. The classroom offered 15 different approaches to endodontic diagnosis with canal preparation and obturation. Techniques I remember such as the step back, step down, balanced force, and flared and non-flared preparation. All of that caused overwhelming array of student options. Preparation method, obturation methods also varied, ranging from single cone gutta-percha, hot gutta-percha, warm gutta-percha, vertical condensation, lateral condensation, etc. That was in the classroom. Now in the clinics, the diagnostic practices were limited to 2 tests, electric pulp test and, when needed, thermal testing or heat testing. They called it PD, pulp test. That's it. Endo was pulp test. Restoratively, every endodontically treated tooth, ETT, was required to receive a gold cast post and a core and a full coverage crown. The graduation requirement at that time were 13 assortment teeth endodontically treated and restored. So at that time, as a teacher, I observed multiple inconsistencies in dental student education. These inconsistencies were translated into patient care, mistakes, error, and increased risk of complications. Why was that? Because clinicians were applying their own individual preferences and clinical judgments to the situations at hand. Moreover, obvious lack of evidence-based practices in managing endodontic treatment, failures, complications, etc. All of that led the residents and the students to adopt unsupported and harmful practices, actually. At that time, back in the 80s, I developed the 4R operational diagnosis protocol to address the issues of inconsistencies and implement evidence-based, available information in the literature, protocols, which allowed a standardized, more uniform, precise approach to endodontic diagnosis and treatment. The purpose is to improve patient care outcomes and reduce errors and misdiagnosis and complications. It's been over 50 years since the introduction of that protocol. It has been used in education and training of endodontists, more than 160, 170 of them, and thousands and thousands of dentists in California and all over the United States and then overseas. It has been translated into many languages. It has been revised few times just for the purpose of improvement. And most of these revisions were contributed by the users. The 4R operational diagnosis protocol is a good protocol for endo, perio, and prosto. Thank you for listening.